Hello again. This is Dr. Jonathan D. Hawk coming to you from the North Shore of Boston with another thoughtful patient's guide to plastic surgery. Today I would like to talk with you about an exciting new option for women considering breast augmentation, the IDEAL brand breast implant. This is a completely new type of implant that has just become available for limited use, and I'm pleased to be one of the first practices in the New England area that can offer this to my patients. The IDEAL brand breast implant is a structured saline implant that claims to give the natural feel of a silicone implant without the silicone gel. So it's important to remember that all of the implants currently available on the market, including the IDEAL brand breast implant, are still silicone on the outside. The most common implant used in the country is a round, smooth implant filled with silicone gel. I have one of them here today. This feels the most like a woman's breast and has been shown by the FDA to be safe and effective. The gel is cohesive and kind of like Jell-O on the inside. Now, all implants will fail eventually, and if you analyze the different studies that are available, about 8 to 10% of breast implants will have ruptured at the 10-year mark. The numbers vary depending on the study that you look at. One analysis in 2014 in the Archives of Plastic Surgery found that silent ruptures occurred in 9 to 12% of cases 8 years after augmentation. This includes the highly cohesive or gummy bear implants. The FDA recommends in their labeling instructions that you get an MRI 3 years after surgery and every 2 years after that to check for a rupture. So what is a silent rupture? Well, the outer shell of the implant can rupture, but the cohesive gel stays inside that capsule scar tissue that normally forms around the implant. So there might be no visible or palpable change in the breast. The rupture could be silent. Is it harmful? No. In the short run, not much is seen. Over the course of many years, that silicone may cause some irritation in the local tissue and localized thickening and calcification of the breast, but that can take years to happen. But if we know that the implant is ruptured, we generally want to replace it. But not everyone wants to do an MRI, and there are also some studies now showing that high-definition ultrasound can be effective in picking up a silent rupture. So the trade-off with the silicone gel-filled implant is that they feel the most natural, but it can be harder to know if they've leaked. Now we also have saline implants, and I have one here today. This is an outer shell of silicone, but is filled with saline. It's easy to tell if it has leaked. The saline is absorbed by the body and the shell collapses, causing the breast to go flat. So easy to tell if they've leaked is a great advantage of saline implants. But the trade-off is that they do not feel as natural. Some patients describe them as feeling like a water balloon, and they have a tendency to scalloping or folding at the edges, which is more likely to have palpable and even visible ripples and wrinkles. This scalloping and rippling is even more of a problem for women that have thinner tissues. There's not as much tissue to kind of hide and cover the implant. Another issue with the traditional saline implant is that the saline flows through the implant like waves of the ocean pounding against the beach. This is called a water hammer effect and can potentially cause more stretching of the breast tissue with time. The American Society for Aesthetic Plastic Surgery in 2014 reported that just 20% of breast augmentations around the U.S. involve saline. So the majority of patients are choosing silicone gel, wanting the most natural feel, and deciding that even though it's more difficult and involved finding when the outer shell of their implant has failed, the silicone gel will generally not cause problems in the short run. So they're picking more natural feel or harder to tell if it's leaked. Again, it's important to remember that the FDA has shown silicone gel implants to be safe and effective. But Allergan recently released an advertisement for their new Inspire brand, which is a silicone implant, but it looked at a 300-patient survey, and it showed that 52% of patients are still worried about silent ruptures, and despite the FDA and the science, 45% of patients are concerned that silicone gel is a foreign substance, and 34% of patients have a fear of silicone altogether. So in comes Dr. Robert Hamas, who's a plastic surgeon from Dallas, Texas, and the story goes that he was traveling on an airplane with his wife and enjoying his glass of bourbon when they hit some turbulence and it caused his drink to slosh out. Now, Dr. Hamas is a thoughtful man. He started to think of how he might prevent the saline from sloshing around in a saline breast implant. So after some trial and error, he created a series of implant shells that are nested together like Russian dolls, and has two separate chambers that hold the saline. This internal structure limited the saline's ability to move while supporting the implant edges to reduce wrinkling. I have one of the implants here. The company, IDEAL Implant Incorporated, which he started in 2016, is majority owned by about 120 board-certified plastic surgeons and gained FDA approval in 2014. In September of that year, a few surgeons, mainly just the original investors, were given limited access to the IDEAL implant. Starting this year, it has seen limited release to other board-certified plastic surgeons, and I'm pleased to be one of the first plastic surgeons in the New England area to be able to offer this to my patients. So the IDEAL breast implant here in my left hand is a structured implant filled with saline. The saline does not slosh around the implant. It feels more natural than a saline implant, more like a silicone implant. There are less ripples and wrinkles at the edge, and it behaves more like a silicone gel-filled implant. You can see tipping them up and looking at edge collapse and looking at the shape of the implant. So they've not been out as long as our other implant choices. They currently only have data out to 6 years. Their 10-year study won't be completed until 2019. But the early data is quite good. The first round of trial implants from 2009 were made in Montana and had some manufacturing issues with the valve and fill patches that led to some early ruptures, but they quickly corrected that and they've moved their production to a state-of-the-art robot manufacturing facility in California. Well, it's not fair to compare their 6-year data to other companies' 10-year data, but the numbers for rupture and deflation compared to other implants now at 6 years are quite good, better in fact than the others' reported data. So the IDEAL brand breast implant is a new and exciting choice to have for women considering breast augmentation. Will it be for everyone? No, it does feel much more natural than the saline, but still not quite as natural as the silicone. It's not available in as many profile choices, and a textured version is not available for those cases where a textured implant may be more of an advantage. But it does solve many of the problems of the traditional saline implant. So here's the saline implant and IDEAL implant. So I always tell my patients that the process of breast augmentation is a thoughtful consideration of the trade-offs, and I help guide them to pick the implant that fits their needs and goals the best. So I'm thrilled to have a new choice to offer to my patients with the IDEAL brand structured saline implant. This is going to be very good for women who are concerned about silent rupture and silicone gel, but wanted a choice that is significantly more natural and feel than the traditional saline implant. So once again, this is Dr. Jonathan D. Hall coming to you from the North Shore of Boston with a thoughtful patient's guide to plastic surgery. Thanks for listening.